So in this next conversation, I'm excited to sit down to talk about policy solutions. And I get to introduce U.S. Congressmember Dr. Maxine Dexter, who represents Oregon's 3rd District. Round of applause for her, please. Thank you. So nice to have you here. Thank you for joining us. I know these are busy times in Washington.
Well, not as busy as we'd like them to be, but yes, grateful to be here. Thank you.
So as you know, today's discussions are really centered around food loss and waste. Food packaging has to be part of that solution. I'm wondering if you can talk about your work to ban forever or PFAS chemicals from consumer goods and how you see that being part of the food waste sort of story.
Yeah, so first, I'm a physician, I'm a mom, and was an Oregon state legislator before I went to Congress. And Oregon is a progressive, motivated, and innovative state. And so Senate Bill 543 we passed, I believe in 2023, was banning forever chemicals. And we had tried to do it in 2021, so like many things, you keep going. So PFAS outlawed in Oregon, and then it also phased out polystyrene. So with those two, really could make a huge impact.
Right.
And we're already seeing change in behavior in Oregon. It's time for it to be a national endeavor. And frankly, we all are seeing more and more the impacts of those microplastics and impacts on health, and that we can't get it out of the ecosystem. So I think people are starting to realize it's not just about trash if you don't care about trash. It's that it's actually getting into our water systems. It's killing our environment in multiple ways. So there's lots of opportunity there, either from an economic or a health perspective.
Right. I know a lot of mission-driven CPG companies and retailers are very interested in having more sustainable, healthier packaging. Are there ways that federal policy can help them do that?
Without question. I mean, whether it's just changing the dating on packages, obviously you will produce less if you aren't turning it over as quickly. My family, raising my kids, we'd have a no plastic challenge going to the grocery store. It's impossible, like yogurt containers and all these things. Those are easily addressed changes that if consumers are demanding it will actually drive change. And so I think consumer behavior needs to drive the changes, or as we heard just recently, policy. So it's a win-win, but if we are demanding it, it's easier for people like me to pass the laws.
Sure.
So I think writing your grocery store, writing your representatives, but also making different choices and buying those glass jars and things that may, cost more. Obviously, glass is also harder on the environment. So going to your local producers as well, if we can incentivize more of a supply chain incentive to keep things local. I think that's a huge environmental policy that we haven't really focused on enough, that supporting our local farmers, supporting, those produce items going into our school lunches and other things, we really can make policy that builds a more resilient ecosystem as well.
Yeah, local and regional procurement would be a huge part of helping solve a food waste problem. You mentioned being a doctor, being a physician, and you're one of several in Congress. And I'm wondering if you can talk about how that affects your sort of day-to-day work as a policymaker.
Yeah, we're seeing more doctors. I just came from a Power of Women in Medicine conference, and there's a huge increase in people from the medical fields interested in policy because, frankly, the medical system and healthcare is really in a steep decline and is really grappling for change. So I think that's driving part of it. We have 6 Democratic physicians in Congress now, and so we started a doctors caucus, and we're trying to leverage our input in our different areas, and luckily we're all different specialties. So I'm focusing on air quality and different policies that impact air and the health that we all are seeing erode because of poor air quality in this country. So it's driving policy that I'm trying to pass, but also just perspective that when you come to Congress, a doctor and maybe a teacher are some of the only people who have engaged with, and nurses obviously, but that have engaged with every different socioeconomic level, every religious, I've never taken care of a Republican or a Democrat, I've only taken care of people. And so you have an ability to interact in a different way and have perspective from years of practice that many people, if you've been in industry or banking, you may never have engaged with people who are houseless or as well as billionaires in the same day.
Right. Yeah. What a unique perspective. I would be remiss if I didn't ask how the Make America Healthy, Make America Healthy Again Commission, sorry, I didn't mean it that way, how that's impacting your work.
I mean, it's really a defense position right now. There are some, things that we heard earlier that this administration is incentivizing that is good.
Right.
But this whole endeavor is rhetoric, and it's certainly not using science. And I think that's really what scientists need to really assert, is that there is not science that is not based in reality. And that's part of what is being promoted right now. And it's really dangerous for our communities, certainly for our health. And when you can no longer trust your federal agencies and the information that they're sharing, it really puts a lot of burden on states and other entities. And we're going to see that right now because the FDA and the CDC are going to become a lot less reliable, and we are going to have to fill the gap.
You mentioned sort of the disdain the Maha Commission has for science-based evidence. What could we do to turn that around as citizen eaters, as people who vote?
Just demanding the information is one thing. We heard there's not going to be food insecurity reports. Like, that is absolutely egregious. We know that the SNAP cuts are going to lead to increased hunger and food insecurity. So we should be demanding that information. And as someone who represents almost 800,000 people, when you start getting outreach, it starts driving your behavior. And it also gives you protection. If I care deeply about the environment, but nobody's writing me about it, it's hard to drive that policy. So please don't assume that if you're from Maine or Oregon or somewhere that your voice doesn't matter. It actually does drive the work that we do. So reaching out to your elected leaders, sharing what you want, even if you know that they're aligned, is really important.
I've heard from other members of Congress, like Congresswoman Pingree, who's also here, that those stories are really important, that you need those stories so that you can communicate them to other policymakers. Is there a particular story that you've heard from a constituent that you want to share?
I just came from this Women in Medicine conference, and so I think that was part of what I was telling them, is that using, your place in the community to tell stories. And so many of our physicians are seeing that, but I'll just share the story that I think, and it's not food related.
That's okay. We love having you here, so thank you.
No, thank you. But immigration policy is obviously on everyone's mind right now, and I had a friend of a friend whose family was disappeared. And she reached out and said, Maxine, they lived in your district. We can't find them. What can you do? And this is a mother and her 4 U.S. citizen children were at Peace Arch Park on the northern border of Canada, seeing her sister and her niece and nephews. And her mother is here from Honduras on a legal visa. And they went to have a reunion. And they've done this before. They did it in March. And as they were hugging, theoretically, the sister was across the border. And they were all taken into custody and disappeared. The American family was taken into custody and disappeared for 2 weeks. And so our team relentlessly, I literally got in the car and drove. We didn't know if we were going to find them in Tacoma or Seattle or Bellingham. And we just kept going until we found them. And so, but that story is really emblematic of what people across this country, thousands, hundreds of thousands of people are dealing with right now. And being able to tell that story helps people understand it in a different way. Like they literally were just there for a reunion and were taken. And these are for U.S. citizen children. You know, not that that should make the difference, but that is not the story that we are being told right now. So I know this is an environmental and food related issue, but the stories that are most resonant are the ones that we can relate to ourselves. And the idea of being at a family reunion and having your family disappeared, I think, is something that none of us are here for, and certainly nobody should have been electing somebody to do.
Absolutely, and these are people who contribute to their communities. They're working very hard. They're spending dollars in their communities. Can you talk a little bit about that and in your state, sort of the vibrance of the immigrant community?
Well, and I would say just the community in general. And one other community group or company I wanted to highlight. There's a CEO, Orlando Simpson, who started City of Roses Recycling, and he is really leading in Oregon and in Portland in particular, where we have local policies that are driving decline in food waste. So in Portland, you actually do have mandates if you make more than 1,000 pounds of excess food waste a week that you have to recycle or compost it. And so Orlando has started this. It's a Black-owned family company. It's thriving, and he really is digging into the circular economy. So his family is making a difference. Our immigrant families are clearly making a difference, and I represent a agricultural area where we had cherries dying on trees and pears that rotted on the trees because people were afraid to harvest them. Some of the most expensive crops, and our state is dependent. We are an export prominent state, so we are at extraordinary risk economically if we can't get our exports out. So tariff policy, immigration policy, these things are really impacting us in our food systems as well as in our immigration systems. And this is just, I think, really a time for us to see the intersectionality of all these different challenges that we are encountering every day, whether it's on the streets and speaking up or advocating for a change because you care about your farmers or you care about having access to food. The 30% increase that we saw this year in food prices is not true unrelated. These are related issues on tariff and immigration policy. Yeah,
and people are seeing it in their own grocery stores. They're seeing the lack of produce, and because there aren't people to go pick it, and it's a terrible time. You're fairly new to Congress.
I am.
How has it been trying to work across the aisle?
I think that's also something. When I was running for office, I said durable policy has to be bipartisan. And we're seeing that, whether it's the Inflation Reduction Act being eroded because people didn't believe in it on the other side, or environmental policy that we're seeing executive orders. We need to get grounded in that we all want the same things. And I worked on this with housing in Oregon, that we had a bipartisan issue. We had all the members of the community at the table who generally were enemies, but we all agreed that we needed more housing. And so we were able to get to policy change that helped innovate how we built and paid for housing. We need to do that in every area of congressional leadership. And frankly, government needs to work. And so it's not just making laws, but enforcing laws, hopefully making fewer laws that we actually want to prioritize and enforce. Americans need to demand better from their government. Politicians need to demand better from themselves, and working together is part of that. And we have to get over this partisan divide that we have. So the Doc Caucus, I've been reaching out to all the Republican doctors. Some of them, are challenging for me for what they've done personally, but we all agree on certain aspects of healthcare policy. You got to find those alliances, and people who you think differently than you. Cliff Bentz is the only Republican from our state. I talked to him on the floor the other day, and I was stunned by some of the things he's working on and willing to collaborate on. We have to rebuild that trust, and if there's not a better time than now, I can't imagine what it is, because we all are seeing the threats to our communities right now.
Yeah, I couldn't agree more. Thank you so much for that, because we need more of that bipartisan action. I'm wondering if you want to give a call to action to this audience that they can take away.
Yeah, so the SEEK, it's a sustainable environment, and oh my God, all of a sudden it's Energy, thank you. Coalition. All of a sudden, I knew I was going to forget when I was up here. We have 100 members of Congress. It's a caucus for environmental and energy policy sustainability. And we have a thriving economy initiative that we really need to lean into. So there's many thought leaders and investigators and policymakers here. We need your help. We are trying to build the policies for the next, iteration, hopefully a bipartisan one that is grounded in science and reality. So please reach out to SEEK, reach out to us. We have a lot of interest in building things from the bottom up, because honestly, the most important and impactful policies are going to really address the issues that people are facing every day, and we need to dig into that part right away.
Great point to end on. Thank you so much, Congresswoman.
Thank you.
Please give her a round of applause.